Welcome to this week's edition of the Yamhill Leadership Roundtable. We have with us Director Lindsey Manfrin from Yamhill County Health and Human Services. We have Mayor Rachel King from the City of Amity. We have Mayor Linda Watkins from the City of Carleton. We have Patrick Evans from Turtle Dove Shelters and many other things. We have the City of Amity, which I will assume is Mike Thomas. And we have Fritz from Senator Wyden's office. And in a few minutes, we'll also have Al Bannon representing Congresswoman Bonamicci. And today is a very special one because we have a major advance on the COVID vaccine front to talk about. And we also have the major infrastructure bill. I hear historic levels of funding going out to cities, counties, and communities to build things. So with that, I want to open it up to Director Lindsey Manfrin, who was with us no later than 1:30 to talk about the pediatric vaccine, access to it, and to take questions. And I know that Mayor King had some questions that she sent to me that I apologize I didn't get to you, Director Manfrin, in time, but Mayor King is on and she's ready to ask them of you. I actually got some from social media that were very much for Director Allen from the Oregon Health Authority and not for you. So with that, welcome Director Manfrin, and thank you for joining us.
Yeah, thank you for having me. And I'll give a brief update and sort of status of where things are at, and then happy to take any questions. As Commissioner Kulla mentioned, last week was a big week. The Pfizer vaccine was authorized to be used in those 5 to 11. And previous to that, it had only been for 12 years old and up. So that was exciting. Just a quick about the process that it takes for that to happen. After clinical trials have been done, that information is sent to the FDA, and the FDA has to authorize the vaccine from a safety standpoint. At that point, that information all goes to the American Immunization Practices Group, which is out of the CDC. And it's a group of people that are not part of the CDC, but are part of this group. They go through a similar process and review data and then make a recommendation. That recommendation then goes to the CDC director, and that CDC director has to approve that for it to become a CDC recommendation. Oregon, as part of a handful of other states, Washington, Nevada, and California, early on in the pandemic, put together this Western States Pact. And so in addition to that CDC approval, in order for Oregon to be able to utilize that vaccine, it also had to go through that additional step of being approved by the Western States Pact, and it was. So we were able to begin vaccinating those 5 to 11 on Saturday, which was exciting. And I want to just take a brief moment to say thank you so much to all of those people who stepped up and helped by volunteering in our clinics and supporting that work. We cannot do it without you. That day, we were able to vaccinate over 200 kids, 5 to 11 years old, in addition to many other people who were getting boosters and other, first, second doses as well, which is exciting. We also had another successful clinic last night and had almost 100 additional 5 to 11-year-olds vaccinated. So right now in the state, I think there's a little over 5,000 people who have been 5 to 11-year-olds who have been vaccinated. That data is updated as of the 7th of November. And again, over 300 of those are folks in Yamhill County, and we're really excited about that. All the information about our vaccine clinics, whether it's for 5 to 11-year-olds or 11 and up, can be found on the public health website. We've got a list of all the different events of where we will be. The vast majority of those are walk-ins, so people are able to just attend them. Some of them are at our clinic at public health, some of them are at the fairgrounds, and others are just around in the community. We're trying to be in as many places as we can, and we're trying to get to places where it'll be convenient for families, places like schools and things like that on sort of all ends and through the entire county. Certainly as the vaccine is beginning to roll in, people will find it more available in coming weeks at their healthcare provider's office as well as pharmacies. I would recommend giving them a call first to see what they have on hand, and certainly if they're not able to get you in, we're happy to serve you at public health. I will say non-vaccine related, we had seen a decrease in cases a few weeks ago, and that decreased, really plateaued for about 3 weeks. And we were at or around 200, a little under for that 3 to 4 week period. Unfortunately, last week we saw a pretty significant uptick, and our case counts were close to 300 again at 293. So that represents a pretty substantial increase from 1 week to the next. We're tracking that very closely, trying to understand any patterns or things that might help us understand what's happening. And I think likely we're beginning to see a lot of people gathering. We've had some holidays, and we know holidays are coming up. And so just really wanting to take a moment to remind people about the safety precautions and being mindful, staying in places with good ventilation, mask use if you're with a larger group of people, and of course, you know, the one of the best ways you can keep yourself safe is to get you and those around you vaccinated for sure. So I'm happy to take any questions about anything vaccine or COVID related.
Awesome, thank you so much, Director. Mayor King, do you want to start us off? Or if you're okay with that, with the questions that you specifically had?
Yeah, I just had to pull them up because my mind went blank. Also, thank you.
I knew myocarditis. That was the only thing I could remember.
Yes, you answered many of my questions. That was the first one. So the commissioner asked for us to listen to concerns around the community. And one is the myocarditis and pericarditis that is associated with vaccines at some time. So could you speak at all to how prevalent that is as a rare side effect versus being infected with COVID?
Yeah, I'd be happy to. So the two vaccines that have been associated with myocarditis or pericarditis, which is inflammation sort of the area around your heart or the muscle of the heart, is the Pfizer vaccine and the Moderna vaccine. So, you know, we have 3 approved vaccines. So it's those two. And it is more, it seems to be more prevalent in those who are under 30 and those who are male. I don't think there's a lot known about why those two categories are at higher risk, although I will say overall, and I'm going to pull up try to pull up the exact numbers, overall, the actual number of people is extremely low. So right, it is a risk, right? And we want to make sure people know that risk and that they are aware of that risk so that they can make their own informed decision about them or their child. But the risk is quite low. And what the latest research is showing us is that both for adults, we know at this point in time, we know for adults, and it is appearing to be the same with children as well, that you are more likely to experience myocarditis with COVID illness than with the vaccine, because COVID illness, getting sick with COVID, also causes myocarditis. I will also say the vast majority of those myocarditis cases with related to vaccine have been mild, treated generally with things like ibuprofen and rest and things of that nature. But of course, what you would want to be looking at, you know, as a parent or someone who's a guardian of someone who may have been vaccinated would be, you know, seeking any sort of medical attention if there was any complaints of chest pressure or pain. I will say as a nurse, anytime you have a child complaining of chest pressure or pain, whether or not they've been vaccinated, please contact your healthcare provider. That's always something you want to look into and make sure you get someone to check them out for sure. Is there anything more specific that would be helpful around that, or did that answer your question?
No, that was a great answer. Thank you.
You're welcome.
And then I had another question, and it was related to there's the multi-inflammatory syndrome type illness that's seen in kids post-COVID infection. I was wondering if it's too early to know how being vaccinated might lessen that risk, or if it's too early.
It's a really great question. I don't know that I've seen any definitive answers to that specifically. And I think the other big question that's out there that we're trying to understand is related to long COVID, long haul COVID. And, you know, where you hear these stories of individuals who have extreme fatigue and really other sort of devastating symptoms that last months and months. And kids are not alone. They're not excluded from that. Certainly we see adverse reactions to having COVID illness with kids being less than adults, but it doesn't mean they don't exist, right? They still do. We still have more children who have died of COVID than we typically see in the annual flu season and things of that nature. So while the risk is much lower to kids and youth than it is to older adults, it's not eliminated. So those are pieces that we're still trying to understand for sure. And great questions.
Mayor has some more questions too, correct?
Oh, I can let someone else.
I was going to say that if anybody, we do have other folks, but I wanted to say that Mayor does have some more questions that she pulled together from community. So, but if there are other people with questions. Mayor Watkins says no, and that's the only other one I can see. So I'm going to go back to Mayor King then.
Okay, I will just go ahead and ask then, do you have any indication that a COVID vaccine would be required for this young age group for school purposes before it's out of the emergency authorization? I know this is brand new. It's the situation is fluid, but what are your thoughts on that?
So certainly I can't make any predictions, right? We learned that a long time ago with COVID, right? We make our best projections, but things can take twists and turns. With that said, I don't have any indications that any requirements related to the COVID vaccine and say school attendance or things like that would be done outside of the typical process where that happens through the legislative session. So that's my best answer at this moment in time, that I'm not hearing anything that would indicate that.
Thank you. And I think that my answer would be the same, because who knows? You never know. But I know that you're coming from a different perspective. So I'm glad to hear that. Thank you.
Mm-hmm.
Good questions. Mayor, have you gotten the sum total of them?
I believe so. Thank you.
Yay, thank you. Well, Director Manfrin, I wanted to ask how, so we've seen, and thank you, first of all, for talking about pediatric vaccines. It's super helpful. And it seemed like there was this pause period where none were available, and then you were able to provide them, but a lot of other communities haven't been able to. Their appointments are a week out or 2 weeks out or 3 weeks out. And so I know that people have come to our community because of that. Do you know of any logistical hiccups with that, or is it just, it's slow to roll out?
Yeah, I don't have any definitive information, but I can just share, a bit of anecdotally what I'm hearing is that there are some differences between the pediatric Pfizer vaccine and the older youth and adult vaccine. It's actually a different formula. It comes in a different container, so it's got some logistical pieces. And I think there has been some hesitancy and some facilities and clinics really wanting to ensure that they have everything down and ready to go. But I think really that we're hearing a little bit of that, but I think the biggest thing that we're hearing is staffing challenges throughout other health departments, which I can share more about ours, now that we don't experience that for sure, but others are experiencing it as well. And then just healthcare providers in general, whether we're talking about primary care providers, hospitals, or other places. Staffing is challenging, and it makes it hard to expand a service and to know that you're going to anticipate getting a huge influx of people. And so I think that has largely been what the challenge has been. And like I said, we're not, it's not that we're not experiencing our own staffing challenges. We've actually had a fairly stable public health crew this whole time, which has been amazing, and I'm so grateful for them. I think one of the things that we did see is early on with the vaccine, we had so many dozens of volunteers that were coming in on a very regular basis, and then that sort of waned because the vaccine needs waned, and what we were able to do wasn't needed to have that large of a response, and so we scaled back, and now we're in this state of needing to scale back up, and so that's why we've been sending out requests through Facebook, through email distribution lists of partners and people to say, hey, if you're interested in helping and supporting and volunteering, here's how you can do it, because we're definitely in that phase of really needing to increase that pool again.
Okay, that makes sense. And I will say that when we came and got our kids their vaccine doses of their first round over the weekend, the volunteers were as happy as the children, I'm pretty sure, if that's possible. So plug for volunteering.
Wow. It was a great day. Yeah.
Mayor King.
Thank you. I thought of another question, and I feel like it's important to ask. So for parents that have a child, 11 years old or older than 11, almost 12. I know the dosage is different on those vaccines, and there has been questions about, well, should I wait 3 months? Should I wait the 6 months? My 11-year-old is the size of an 18-year-old. Can you speak to what you would recommend for people in those type of situations?
Yeah, that's such a good question. A couple of pieces to it. Oftentimes when we're looking at dosages of medications for pediatrics, we do a weight-based, calculation, and that's how much medication they get. And that works in a lot of situations. And I also want to just say, in medicine, we really remind folks that youth and kids, and especially as we get younger and younger, aren't just little versions of adults, and their bodies do things differently, and they react differently, they respond differently. And so that weight-based measurement isn't always the best approach when we're doing something. So I think that's some of what's playing into this. As far as the question around, you got a child maybe on the cusp of turning 12, what do you do? One, I think it would be important to think about your own risk factors, that child's risk factors, and perhaps even the people around them, and the risk factors. Do they live with anyone who's immune compromised? Are they in circumstances and situations where they're put in situations that are high at risk? Things of that nature, and that might help you think through what you might be wanting to do. Honestly, I would say unless you're within a few, a month or so, I would recommend just getting the vaccine. I think that we're seeing great coverage. The clinical and, evaluations showed really high rate of success with the vaccine in younger kids, looking at that 11-year-old population. So on the whole, my recommendation would be, if you're wanting to get your child vaccinated, I would just get it at the soonest opportunity that you're able to. And certainly if there's other, mitigating risk factors, it might be worth, consulting with your healthcare provider on a one-on-one, basis, where they can dive into a bit of your circumstances a bit more.
Good question. We just decided that our almost 12-year-old, he was just going to get it. So, and then Director Manfrin, you said that we're seeing an increase in case counts. Have we seen? I know it's kind of early, but have we seen an increase in hospitalizations? And then, do you think it's related, the increase in case counts is related to gatherings around the, Halloween, or just in general? Like, do you have any sense of what has changed?
Yeah, it's a great question. I think that certainly the timeline matches up with thinking about Halloween and potential gatherings. I think the age bracket lines up with maybe thinking about Halloween. We're really seeing the highest numbers of cases in the 0 to 19-year-old range, followed closely by our 20-year-olds and 30-year-olds. So they're not far behind. Definitely, we're seeing the cases increase in the younger population. So I think that is a possibility. We know that there are some activities and things that are just higher risk that youth might be doing, whether it's related to athletics and things. And we're not seeing a lot of spread with sort of the sport itself. It's usually the traveling, the being together before and after an event and things like that is typically where we see more of a spread, say through like teams or things like that. So I think all of that is probably contributing. I think at this point, we're not seeing an increase in hospitalizations, which is a good thing. As you mentioned, it is a little early. Typically, we see cases increase, and then there's a little bit of delay between that and when we see hospitalizations increase, and then a little delay between hospitalizations and sadly, number of deaths. So it's a little early to say if this spike in cases is related to that. I'm hopeful and hoping that this might be a little spike and then we'll come back down, and that it's not an indication of kind of backtracking to where we were in August and September. But we'll just be having to watch that and pay close attention for sure.
Okay, well, that was super helpful to know. Thank you.
Yeah.
Are there any other questions from folks here? You've got Director of HHS, knows all about vaccines. All right, well, I really appreciate you joining us today. Thank you for shedding some more light on the vaccine, especially for kiddos. So, and then you will have them. So children at the event on Saturday were telling me that there will be some at schools. But I just look at the list of events that you keep updated. So I wasn't sure if that was the case, but you do have regular events scheduled, correct?
Correct. Mm-hmm.
All right, go to the website, people. It's updated and there's lots of information on one page. All right, well, thank you very much for joining us today. Much appreciated, and have a good day. And I'm going to go from Director Manfrin to Fritz Graham and Al Bannon from Senator Wyden's office and Congresswoman Bonamicci's to hear about the, I'm going to call it historic because it's fun to say, infrastructure bill that was passed. And specifically, I asked Al and Fritz to kind of, if they could walk us through how does a community like Amity or Carlton or the McMinnville Chamber, how do you access this fund, the funds that are coming, and kind of how are they being directed to states and local governments? So thank you for joining us. And you can tell us the details too, but I think it's important for people to know, like, what do we do?
Thanks, Commissioner Kulla. Great question. And I'm going to let Fritz answer the more challenging one, and I'll jump in with the big overview. I also have to hop at 1:30, so apologies. I think, honestly, that the quick answer that I can say to that is it's a little early to tell. We haven't gotten a lot of information on how these funds are going to be distributed yet. Of course, the number one thing I can say is we'll continue to engage with county leaders and city leaders and local leaders and let you know as we know more information. But big picture, you're right, it is historic. The bill includes $550 billion in new federal funding for infrastructure. I'll put in the chat specifics for the funding amounts that we have expected for Oregon. I would say big highlights are $529 million for clean drinking water, $100 million for broadband, $39 million to protect against wildfires, and $3.4 billion for federal aid highway programs. So that's sort of the big overview. Of course, we'll continue to be in touch as the funding arrives in Oregon and let you know sort of what the distribution process is. I don't know, Fritz, if you know more specifics than I do at this juncture, but
I don't. I talked to our office this morning, and they said a very high percentage. They didn't want to give one, but 85% are going to go through normal channels for water, through normal grants and that sort of thing. Then that's how they'll get out quickest. But but I completely agree with what you have to say about. Yeah, we don't. It's still very early, and we're still sifting through the stuff.
Okay, that sounds good. So if a community like Carlton had a sewer infrastructure project that they were in need of funding, and they know, oh, there's funding somewhere in a pot of money in the treasury, what do they do hypothetically if the city of Carlton had such a need?
Well, let me go back to Al's the $529 million for clean water for Oregon. So that's over 5 years, and that's goes to the state clean water revolving fund and the other fund. So that, you know, those monies will be accessible in the same process, which I don't know what that is, of accessing those before. It's just been plussed up by a very large amount. So if we're talking about wastewater, I mean, is it EPA? Is it USDA rural? Whatever the monies that they would be going for, there will be more money available in pots of money where they would be getting money for wastewater before, if that makes sense. I don't know specifically though, sorry.
That absolutely makes sense. And then Al, you were frozen. Sorry, no.
I'm sorry. I was just about. I have a 1:30 that I have to hop to, and I'm leading it, so I got to be on time. But I'm in touch. I'll stay in touch with questions. We'll know more soon. We'll continue to send out information as we know more, and I'll try to join. I'll join again next. Sorry, Fritz. What?
Yeah, we'll get back on here too.
Yeah, I was going to say, yeah, well, as I think this is a great tool for us to use to connect with folks. So once we hear more from, agencies, and as the states move to the state, as the funding moves to the state, we'll pop on and help out. And of course, we both Fritz's office and my office work as liaison between agencies. So if there's specific questions around whether or not you qualify, we're happy to help connect with the right folks to figure out what the answer to that is. And awesome. On that note, I'll see y'all soon. Thanks.
Thank you, Al. Okay, so with that kind of intro to it, Joya, Pat, Mayor Watkins, Mayor King, do you have questions for Fritz about what it looks like, funds? Joya has a question. And it's nice to see you, Joya.
I know, I'm sorry.
And not just in a mask.
Here. I've missed all of you. Thank you. Thanks for welcoming me back. Good to see everybody. Fritz, it's been a while. So it sounds to me as though there's a lot of money coming to Oregon. We don't know how it's going to be dispersed. And that, obviously one of the things near and dear to my heart, the chamber can't ask for money, right, as an entity. Right. However, certainly there are community impacts. So for example, the Newburgh-Dundee bypass, I'm going to put a plug in for that. It would be great if there could be some funding to finish that little puppy off. And so we could get, it's not a little puppy, is it? If we could get that finished, that would be fantastic. And of course, our bridges and our roads and all those other things. So I'm looking forward to hearing how this will all play out. And hopefully we'll know soon. Do we have a deadline for when we might know?
We don't. But to this, so there's an estimated $747 million over the 5 years allocated to the state of Oregon to improve public transportation across the state. Right. So that's coming directly to Oregon. Right. In the same pathways that it usually does, and then there are a couple of other transportation pieces like the RAISE grants. Which used to be the build grants, and then the infra grants, which are national competitive grants, and those got plussed up also. So Oregon usually gets one RAISE grant or build grant, and maybe we might be able to get more because there's more money in them. Those are for those big projects. Yeah. Yeah.
Okay. One other question. So the 749 over 5 years is for the entire state. But
correct.
Obviously Portland's going to get probably lion's share of that simply because of its population. And that's unfortunate because small communities like Yamhill County, for example, we have a transit system, right, that could really use some assistance. Correct me if I'm wrong, Commissioner. And just wondered if, that, how is that going to be decided?
I don't know the answer to that question, but we'll get back to you on that for sure.
Thank you.
That's an important question.
That's all. I'm super excited that it passed. Grateful for that. And thank you for being here today and representing and keeping us informed. Thank you for the time.
Sure.
Joya, I will say that I'll grab the slides, the proposal, the presentation from ODOT, but they have. They looked at the initial infrastructure package I want to say in March, and they put together a presentation of where they think it would go to the different pots of money. So they have, they're like 1.2 mil or 1.8 million or something, or sorry, billion is coming to Oregon in this next cycle. And here's how it's going to be distributed between, and Mayor King, I think you saw this one too, but like, here's what it'll go for bridges that are on state highways. Here's what it'll go for bridges that are not state highways. Here's what it'll go to transit. Here's what it'll go to new construction. The one thing, Fritz, that I think I saw was that none of this new money can be used for maintenance, which as a person who knows the value of maintenance was a little bit concerning. And so I wondered if you had any understanding of that one.
I do not, and I will get you some information on that.
I mean, I know that it's fun to build new roads, but at least in Yamhill County, we have roads, but what fails is things like bridges when we don't have the means to take care of them on that ongoing basis, and it's a lot more expensive to build a new bridge. Case in point, the Salt Creek Bridge.
Right.
Okay, that would be great if you could get that.
And in the slideshow, it talks about like public transportation, nearly 200 million in additional funding for public transportation. So it's the same funding pots for that they're coming out of now. It just increased by $200 million. So
Joya,
so hopefully Joya, I mean, if Portland gets a lot, there's more money that will spill over to the rest of the state.
It'd be like when you have a cup and you just pour into it and it just keeps overflowing.
Right, you just got to get your cup underneath there.
Just get your cup and ship it under. Joya, I will say that the conversations that I've had with Cynthia Thompson, our transit manager, we have talked about, she's very aware, she has, like other jurisdictions, she has a master plan, and here are the things, the improvement plan that she needs to do in this order, and that's where she gets her funding, is by having those things in order. So, some of the things that she's working on that she expects to have funding for is engineering and design and purchase of a transit facility, because right now we rent a gravel parking lot along between Riverside and Lafayette Avenue, right? So then part of that too is that not only is there money coming for transit, there's money coming for electric vehicle charging stations. And so putting the two together will be very powerful for our transit center, because we've never had a facility where we could, in any reasonable way, set up an electric charging facility. And you can't really get a grant for an electric bus until you have a charging facility. So there's been a lot of steps for us that the infrastructure bill will make it so that we can do them all, in order rather than waiting in between.
So what I'm hearing, Commissioner, is whoever wants to apply for money should really have some kind of a plan in place to ask for these funds.
That's right.
Be very specific about what it's going to be.
Yeah, and actually you make a really good point. So when Fritz said, money will go into the state revolving loan fund for water or sewer, projects have to be eligible for the state revolving loan, or in order to, a project that a city wants to do for their water system, they'll have to make it eligible for the state revolving loan fund in order to get funding through that. So if there's more money available in that fund, it's more likely that they'll get it and get it to happen.
Right. So if there are any boxes that need to be checked to get that, that's the plan that you need to work on.
Yeah, exactly. So a city like the city of Yamhill, when they're thinking, we need a long-term water supply that's stable, that's not just Turner Creek. Now they have to think, okay, what plan does it need to go in that we can lay out the steps to get a long-term supply so that they can access money for it. Well, Fritz, I want to ask you, is there any money, because we've got Pat Evans from Turtle Dove Shelters, so prompted the question, is there any money in the infrastructure bill for housing that would be accessible to people who are currently on the streets or in very suboptimal living situations.
In this bill, I don't. It's not been on any sheets that I've seen, so I don't think that's in this particular bill. We did get a few things. I mean, that's good for Oregon that the senator got in. Wildfire. He got a $5 billion for provisions for Disaster Safe Power Grid Act. He also got money for $6 billion for wildfire risk mitigation and forest health treatments. So that's good. 3 additional years at $290 million a year for secure rural schools monies, which goes to every county, which is good. And then $100 million to Oregon for expansion of broadband. So
that expansion for the broadband will not go very far, but it's still helpful.
Yeah, and that's nation. I mean, $100 million for Oregon. But it's $65 billion for state nationwide. So we can fill that gap, and then we'll get to the next extension.
Yeah, exactly. And I will say that along those lines, we had our first conversation at the county about what does it look like? What do we want to fund through our broadband and internet expansion with the funding, the first round of federal funding from American Rescue Plan. And it was really clear in our conversation that the county, just like a business, needs like a capital improvement plan for broadband in a community where it's like, okay, we know that there's a gap here and there's a gap here, and this one we'll do now and this one we'll do later so that we can access those federal and state funds.
Right.
Because we don't have a plan because it's never been something that not that we valued, but it's risen to the level of a necessity.
Right. And when you have that plan for the future, then you've got shovel-ready projects now, as you move along so that those can be more ready for, when federal funding comes through.
That sounds great. And at this point too, I want to, since Pat has his camera on, Pat Evans, Fritz Graham, I know that in the Build Back Better, there's funding, there's affordable housing funding. So I figured that, Pat, if you want to ask any questions of Fritz, now's your time, right?
Actually, I don't. We're, for those of you that are not familiar with what we're doing, we're a couple of steps below permanent housing for the homeless. And what we do is we build the portable shelters that you see around town that the homeless are utilizing in lieu of tents and shopping carts. That, at 30,000 feet is what we're doing. There are 2 of us that do it, my 86-year-old neighbor and myself. And we've now put out 37 shelters in the last year for the homeless across the county. We've got them in Newburgh, McMinnville. We don't, I believe, have any in Amity or Sheridan or any of the other smaller towns. But we're going full bore building these shelters, and not a day goes by that I don't get a call, do you have one ready for us? Because they actually do a very vital service, particularly in the cold and wet weather. They're waterproof, they're insulated, and they're portable, so that we hopefully can make a positive impact on the community by having, if you will, a more presentable, I hate to use the word homeless population, where they've got all of their gear safely stowed. And as I say, they can be portable so that they don't feel the need to set up a permanent encampment with themselves and their friends. So if anybody has any questions, I'm always available. We have a website, turtledovetoshelters.com. You can see what we're up to. Thank you, Commissioner, for letting me speak for a moment.
Yeah, thank you, Fritz. You should see a picture of them at some point if you don't know about them.
Yeah, I'll come out, and Patrick, I'm gonna put my email address in the chat. So I mean, this is not the only chance we'll get opportunity to talk. So
good, thank you very much.
All right, are there any other questions for Fritz about the infrastructure package?
So I'm curious, this funding is over a 5-year time period, is that correct?
Correct.
Okay, so will it be allocated in equal amounts over that time?
Another question I don't know. Sorry. I probably in the yearly, I mean, it's probably in the yearly, but way that it comes in. But I will double check. I will double check.
That would be good to know. Thank you. I know that a lot of places are getting their plans together now, knowing that 2 to 3 to 4 years from now is going to be go time, where they're really at a place where they can look and take advantage of these opportunities.
Right. Yeah. Yeah. As soon as I find that out, I'll let you know.
And Mayor King, it may be that it's in the Build Back Better, the reconciliation bill, but one of them I know is front loaded. So there's more money coming at the beginning and then tailing off, but it may be the Build Back Better. And I was going to say, can you talk about where that is right now? Except that Mayor Watkins has a hand raised. So let's go to Mayor first.
Let's see if you can hear me this time. We actually got a booster for my computer. So let's see if, I know, maybe I can talk. It was just a question. Fritz, thank you so much. And you mentioned when you were over here about a workshop for doing some applications. And so I was wondering what the timeline was on that, or is that relevant to this? I'm assuming it is.
Yes and no, yeah. And it's funny because I've been talking about these for 4 months now, and we're gonna do them in December, and it's like that's in, just about 2 weeks, a little more than 2 weeks, and I can't. But no, those are for the congressionally directed spending requests, and there's a form for that, and our process will start in January, but we were thinking about doing something in December, just with using last year's forms and getting the guidance out and having people take a look at it, and then we'll kind of walk through, and then if there's any questions, I'm doing that. So I'm thinking mid-December on that.
Yeah, and I'm sorry that I haven't coordinated the email. I'm still trying to get an email or a meeting between Fritz and Betsy and I. So
right.
All right. Mayor has another question for you.
Oh, just to clarify, so this is not necessarily in reference to the newly approved funding, but we can kind of get some information then on what we're looking at.
Right. This is
more.
Correct. This is additional. This is those are the two bills, and then this is what we'll be doing is for next year's budget. For congressionally directed spending, and so that'll be for 2023. So it's all part of, federal money for projects like this. But yeah.
Great, thank you. I was just clarifying.
No, good.
And then Fritz, what's the status of BBB or the reconciliation bill?
I do not know. It changes. Senators are on recess right now. And so there's some things going on out there, but I think it's fairly on hold until they get back.
Okay, that's good to know. I mean, I saw that Senator Wyden was eating caramel corn, so clearly he's busy, but not in the Capitol.
Right, he's in the state right now. Yes.
Joya has a question.
I heard that they were going to be discussing it sometime between the 15th and the 20th of November, but that was. I don't, it was the news. Right. So I can't be, I can't say unequivocally, but that's what I heard. So.
And that makes sense because the 15th is Monday. So that's when they'll be getting back from recess, or they'll be back. Yeah, they'll be back. So that makes perfect sense.
I feel like they need a different word than recess. Sorry, that's just my editorial comment for the day.
It's Veterans Day recess. They're off because of the Veterans Day holiday. So okay.
Yeah. And actually, to that end, I am going to my commissioner meeting at 2 because we aren't meeting on Veterans Day. So with that, I'd love to do updates from Mayor Watkins, Mayor King, and Joya while we still have you on. And thank you, Fritz, so much.
My pleasure.
I should say, Joya Goodrum, what would you like to share with us? Because eeny, meeny, miny, mo.
Okay, I'll go really, really quickly. I just wanted to let the community know that the Oregon Department of Revenue has a web link on their website, and I've posted it in the chat, but I don't know if everybody can see it. If they go to revenueonline.dor.oregon.gov, they will find a link on the left-hand side rather, to call what's my kicker, and they can click on that, put in their information, and it should display them at least an estimate for what the kicker will be. It's $1.9 billion that's coming back in kicker money to Oregonians. Important. It's a credit. It's not going to be a check. It is a credit, but I wanted to let people know that they should go check that out. And so that's kind of all and one last thing, I just want to thank everybody in the community, the folks that came to, Commissioner, you came to our annual dinner, and we gave out awards, and it was such a lovely evening. It was so nice to be together. And we recognized some wonderful people in our community. Of course, there are so many wonderful people in our community, and we're just really blessed and grateful that we got to be together and we got to honor some folks and to say thank you. So that's it. Thank you so much. Great to see everybody, and I'll try to be on more often. Anyway, take care. Thank you, and I got to buzz off. I'll see you later.
It was great to see you. Thank you very much.
Thank you. Yeah, take care.
Mayor Watkins, what would you like to share with the community?
We've just been kind of working along here on our water system, I think, more than anything else right at this point. I think we've had so much going on in the last few months that we kind of hit a point where we just need to focus on all of the things that we've been talking about for the last few months and not doing a whole bunch more for a while, just trying to get into the holidays and get through things. But we're very, very excited about this whole, obviously the bill that just went through. And I think more than anything, we just want to say thanks, Commissioner Kulla, to you, and also to Fritz and to Betsy and the legislative, or our federal officials for our commission, and our federal officials and our state officials too, for the support that we've been getting from them over this last year. It's been really, really valuable. So, and much appreciated. So I will stop there.
Hooray, thank you. Mayor King. Oh, I just cut off a mayor.
No, I just was wondering, am I actually coming through now?
I heard everything you said.
Yay. Okay, thank you.
Yeah, thank you for joining us. And thank you. Mayor King.
I don't have any updates really to share from the city today. I can echo almost everything that Mayor Watkins just said, though. I think we're in a place where we're just coming together at the end of the year. We have a lot underway on top of, day-to-day work that always needs to be done, and then looking forward to the holidays and the beginning of the next year. This infrastructure bill, I think it will kind of be a wait and see. Because it does open a lot of opportunity, but it's also a lot of work and undertaking, especially for us small cities. And so to focus on what's in front of us and get through where we're at is kind of the point we're at.
Yeah. That makes sense. All right. Well, thank you. And I will just close by saying it's been great to have all of you on here. And I really appreciate hearing from Director Manfrin and Fritz Graham about what's happening at the very local level of clinics and what's happening in DC with vast amounts of money. So thank you to all of you for bringing all this together here today. And thank you, Mayor King, for great questions from community members. All right, we will see you next week, same time, same place. Have a good day. Stay safe, get vaccinated if you can.